Ali Turabi was 5 when his mother brought him to the United States from Iran. Now 35, he's a recent medical school graduate and a DACA recipient. It's been an unusual struggle.
When I tell people, they don't believe it. They're like, "Oh, you're a doctor that's uninsured," and that's the reality in this country. When you don't have something like healthcare for all, single payer systems, people can fall through the cracks.
His experience as an uninsured, undocumented youth influenced his decision to pursue a career in medicine.
I have lived experience, and I am also a witness to the harms that come into play when you set so many barricades in terms of access to healthcare for undocumented folk.
DACA is a program started during the Obama administration that protects some undocumented immigrants who came to the U.S. when they were children. An estimated 8,500 DACA recipients call San Diego County home, and starting this month, they can apply for health coverage under the Affordable Care Act, something Turabi is urging other DACA recipients to take advantage of.
Applying for coverage for my DACA sisters and brothers, this will not impact your immigration eligibility for you or your family. So do not be afraid.
When the Biden administration announced the new rule in May, immigrant advocates worried people wouldn't apply because they'd be afraid of being deported. That's why the National Immigration Law Center is focusing on outreach. Nicolas Espiritu is their deputy legal director.
Maybe up to 100,000 individuals don't have insurance, either because they're students, because they're self-employed, or because their jobs just don't provide it at this point. And this really provides an opportunity to give these individuals the opportunity to purchase quality health care.
A recent survey by the Law Center reports 35% of DACA recipients believe they're ineligible for health insurance due to their immigration status. Turabi remembers how he felt after being hit by a car.
I was so afraid that I literally ran away after I was admitted to the hospital. I told no one, nobody, the nurses, nobody. I just pulled my IV lines out and I ran away. And in that moment, I just thought to myself, it would be amazing if there was a physician that understood my experience.
Turabi hopes to stay here in San Diego.
I want to give back to this community. Like I said earlier, this country didn't give birth to me, but this city raised me.
The open enrollment period runs until January 15th. Heidi de Marco, KPBS News.